6:28 this morning, the Pfizer COVID-19 vaccine now has full approval from the FDA.
This means that Pfizer's vaccine can now remain available on the market after the pandemic is over, and Pfizer will be able to advertise the vaccine directly to consumers. Pharmaceutical manufacturers that only have emergency use authorization are prohibited from promoting their vaccines. The Pfizer vaccine is only fully approved for people ages 16 and older, still under emergency use for 12 to 15, and as a third dose for immunocompromised people.
And this morning, Dr. Dana Hawkinson from the University of Kansas Health System joins us live to answer these questions a lot of people have about full approval. Doctor, good morning. Thanks for joining us.
Hi, thank you.
Hey. So for anybody who might be thinking this full approval of the Pfizer vaccine, was the full approval process rushed?
Right.
We've heard people concerned about this. What would you say to them about that?
Yeah, I mean, I think that's completely the opposite. I think, if anything, it was delayed for more of the bureaucratic reasons. Look, we've had all of the resources put forth for therapeutics and prevention of COVID-19. This was one of those things. So we had a lot of money, resources, manpower, people looking at all of this information. And I think it was more just slowed down because of the bureaucratic issue more than anything. We have more data on this drug, this vaccine, than really any vaccine that has been looked at in the history of vaccines. So I think we do have enough data. We have good analysis showing that these are extremely safe, extremely effective. So no, I don't believe that this has been rushed at all. In fact, I think it is the opposite.
Doctor, we've heard people from both the professional medical field and even politics, the president himself, talking about the hope that this full approval will help with some vaccine hesitancy. People have been waiting for that to happen. Do you feel like that? How confident are you that a full approval is the reason why some people have not gotten the vaccine yet?
Yeah, we do hear that regularly, either in my clinics, we hear it to people that we talk to. Otherwise, we've seen news reports about it. You know, hopefully that will push some of these more vaccine hesitant people or groups or families over the edge to go ahead and get that vaccine now that they know that there's full approval. But again, I think that's just a word. When you're looking at the authorization, when you look and understand really all of the data, all of the studies behind it, all of the technology in the studies that came for a couple of decades looking at this platform of vaccine, looking at this science. So hopefully, overall, yes, it will push some of those people who have been hesitant over that block and being able to get the vaccine.
Doctor, so many kids are going back to school or having their first day today. Can you just talk to us about the situation right now with kids being hospitalized for COVID-19? Is that happening?
Yeah, we do understand that is happening. You know, we have had a few here at University of Kansas Health System. We had on some pediatric colleagues from Children's Mercy yesterday, and they are seeing many more hospitalizations due to COVID-19 now during this surge compared to in the past. And again, I think it does go back to those first couple questions, and it's about getting vaccinated. And this pandemic really now has become a pandemic of the vaccinated versus unvaccinated. And the vaccinated people are going to be much more protected, and the unvaccinated are going to be much more susceptible to going to the hospital. The problem is with the children is that right now there is not an authorization or an approval for those young kids to get vaccinated. So it really does boil down to trying to protect your individual family. And we know how to do that in schools. We know how to make schools safe. And so I think there's a good pathway there for that. But the biggest issue is really waiting and hoping for some swift authorization or approval for the vaccine for those children under 12 as well.
I feel like I could just sit and ask you questions for an hour because of how things have been so rapidly developing. Another thing I wanted to ask, yesterday on the call, you talked about several deaths that you had in the last week from COVID-19 of your patients. When you look at right now compared to a year ago, heading into the fall and winter when we saw that huge increase last year? Pre-vaccine. Now we have a vaccine, and it seems like that trend is starting where we were a year ago. How do you see it placing? Are we in the same place statistics-wise we were then?
You know, I think we're certainly for statistics, if we're talking about age, we're definitely in a worse place. And by worse, I mean that our average age of people that are coming in that are unvaccinated is almost a decade younger than those people that are coming in that are vaccinated. Now, as of yesterday, we only had, I believe, 2% of our patients or 6% of our patients were fully vaccinated that were here in the hospital. So again, the vast majority are unvaccinated. But this puts a strain on everybody. This puts a strain on those individuals who are sick, their families. It puts a strain on the healthcare system. It puts a strain on their employers if they are sick and unable to work. And so the easiest way to prevent that and to reduce that risk is to go get vaccinated. And it's just amazing to me. We still have so many adults who don't want to get vaccinated. Hopefully, if their reasoning is I'm waiting for full approval, well, we know we can throw that out the window, and hopefully this will be the impetus now for even more people to go get vaccinated. But the harsh thing is that it is so preventable, and we can keep people healthy and keep them at work and keep them being mothers and fathers and grandparents. So we know the easy way out, and we just have to make sure that everybody is taking that individual responsibility on and going to get vaccinated.
Do people still throw side effects at you a whole lot when you have these conversations about, well, I've heard these reports of side effects from the vaccine. I've heard of this person getting very sick. I've heard of this person dying. Do you still hear that a lot as the reason why people are not getting the vaccine?
Yeah, absolutely. And the side effects are real, but they are very minimal, and they go away very quickly. We do know we do have good reports that, especially if we're talking about adolescents, their chance of getting actual myocarditis, heart problems from getting COVID, is 10 to 12 times higher than if they got the vaccine, because a lot of people are concerned about that. I had no concerns or qualms about that. My children got vaccinated, and I'm thankful that they were at the age to get vaccinated. If you're a female and you get COVID-19, if you're an adolescent female, your risk of getting heart problems from COVID is 21 times higher than if you get the vaccine. So the vaccine is preventing all of these things. We do hear side effects all the time. Unfortunately, we still hear things about the vaccine may cause infertility. There's absolutely no evidence to support that. We do know that people got pregnant after they got the vaccine, when the vaccine was first rolling out. They have done well. So we continue to hear all of those excuses or reasons, and whether it's a conscious effort or whether the people don't know, it's unclear, but we continue to hear that all the time. But I would say that people who get the shingles vaccine, it usually makes them feel worse than if they got the COVID vaccine. So I think we do have other evidence of vaccines out there making you feel worse, but overall the grand benefit is much greater than any of those transient side effects you may feel.
Dr. Hawkinson, as always, we appreciate hearing from you. Thank you so much from the University of Kansas Health System. We appreciate your time. Yeah. You heard Lindsay mention in the call earlier from yesterday.